welcome our guest, Clostridium difficile.
Woo! Hello.
So, C. diff, what type of organism are you?
I'm the best kind of organism. I'm a gram-positive rod. I'm extracellular and extra fabulous.
What environment do you like to live in, and what climate do you prefer to stay within?
I hate oxygen, and I also hate cold weather. I like warm areas like the human body, and since I can't live in oxygen, I like to live in their GI tract.
How do you like to strike your victims?
I do it in a very sneaky, underhand way. Since I'm an opportunistic pathogen, I get them when everything's in favor of me. When they go to the doctor will prescribe them their antibiotics, and if it's a broad spectrum, they'll knock out all the other microbiota, but I'll still be there, and I can germinate and get you sick.
Where do you strike in the body specifically, and where are you happily infecting people?
I specifically strike in the GI tract, and I happily infect in places such as nursing homes, nurseries for the babies, and hospitals. I'm on the surfaces, I'm in the bed linens, I'm on the counters, underneath the nails, and the cribs with the babies and the diaper pails. I mean, I'm everywhere.
What's the most common way you are infecting people?
I take the fecal oral route. I mean, it's a really good route. It really works for me because people just poop me out, and I hit the air and I form an endospore, and people just fail to wash their hands and sanitize correctly, so they spread me all over the place. They don't even know, and so I'm everywhere. It's really easy for me, actually.
How infectious are you, and what amount of dose does it take to infect someone?
They're not really sure of my infectious dose. I'm part of everyone's microbiota, and everyone's different, so they're not really sure of that yet. However, they do know that I am very infectious. I'm the most common infection in the hospitals. In the U.S., I cause 3 million cases. I do that about every year, and as a matter of fact, if you stay in the hospital 2 days, 10% of the patients there will contract me.
Wow. What special features do you have that sets you apart from others?
I have toxins. It's called toxin A and toxin B. I also have endospores, and that allows me to live in harsh environments.
How do you specifically infect others?
Well, I do that with my toxins, basically. Toxin A, it's an enterotoxin, and it attracts the phagocytes and inflammation to the area. However, a phagocyte can attach to me. I have a capsule. So basically the phagocytes and the inflammation just cause tissue damage. And also toxin B, it just destroys the actin, which in turn destroys the whole cell cytoskeleton.
What would someone feel like if they were to strike at the best time for you to grow?
They'd have some serious diarrhea. If you have a mild case, you would be going, I guess, 3 or more times a day. I mean, it's mild, but it's still some serious diarrhea. If you had a more severe case, though, you'd be going about 10 to 15 times a day. You'd have abdominal pain, you'd have blood or pus in your stool, you'd have diarrhea, and you'd experience weight loss and dehydration.
What's the worst thing that could happen to someone that was infected by you?
The worst thing is death. In mild cases, like I said, it's just the diarrhea. But in more severe cases, it can cause necrosis, and that comes from the toxin A causing the phagocytes and the inflammation to destroy the tissue. You can also get the pseudomembranous colitis, and that basically just shreds off your intestinal lining, and if it gets to your colon, it just puts a hole in it basically, and if fecal matter gets in there, it just causes a big infection.
Is there any way to prevent you from taking over the GI tract?
Well, since I'm in everyone's microbiota, I mean, there's really nothing you can do about it if the doctor gives you a broad spectrum antibiotic, because more than likely I will take over. So there's really nothing you can do.
How would you be diagnosed in a laboratory scene?
Well, they can find me if they put me in selected media. They can just find me, the Clostridium difficile, or they can find my toxins. If they do an immunoassay, they can look for the presence of enzyme A.
How would someone go about treating you if you were to evade their immune system?
Is this going to be off the record?
Yes.
Because I have a job, you know.
Okay.
Okay. Well, if it's just a mild case, just the diarrhea, just stop taking the antibiotic. Your normal microbiota will grow back, and I can't compete with them, so I'll just go back to my vegetative state. If it's a severe case, however, you need to be treated with vancomycin and just another metronidazole.
Is there any last comments or tips you'd like to leave us with about yourself?
Of course, I want you guys to read my brochure. It's got everything you need to know about me.
Well, now you've heard it from Clostridium difficile. Now what are you going to do to prevent yourself from catching her infectious disease?